The Dental Wellness Trust was set up by Dr. Linda Greenwall in 2011. It was set up to help children with their oral health and ensure that they have the education that they need. They have a global reach with their toothbrushing programs, having a huge impact in South Africa, Kenya, Indonesia, and here at home in the UK. Dentists across the UK are currently having to provide children as young as 2 years old with fillings and multiple extractions under general anaesthetic.
Concerns over the amount of tooth decay in children.
Research by dental surgeons shows that it has led to more than 100,000 hospital admissions for children under the age of 10 in just a 3-year period.
These children are in needless pain, missing days of school, some being teased by their peers, and generally having a poorer quality of life. In the UK alone, 44,000 children were admitted to hospital for tooth decay. 26,000 of these children were aged between 5 and 9 years old. These figures are astounding considering that NHS dental treatment is free for all under 18s and that dental decay is preventable with diets low in sugar and maintaining good oral hygiene. These figures are unacceptable in the UK. The Dental Wellness Trust is fighting the crisis of childhood dental decay by training teachers to implement a supervised toothbrushing programme for children in nurseries, reception and Year 1. They have already made a positive impact on 2,000 school children in Luton and Newham alone and are currently expanding the programme further to reach a larger cohort of children in high-needs areas of London. In August 2019, 6 dental students flew to Cape Town, South Africa to where the programme first started. During their time as interns, they helped to carry out the daily runnings of the toothbrushing programmes in the townships of Mufulini and Kailicha. They visited a total of 36 educares and delivered 10,000 toothbrushes.
I'm Jan Toy. I do work for the Dental Wellness Trust. We got operations in Mufulini and Kailicha, and I do work with the mamas, supply, transport, all the toothpaste and toothbrushes for them, and then with all the volunteers I work with, and I make sure everybody does it in a safe and sound environment.
Toothbrushing mamas who run the supervised toothbrushing programs were given seminars by the interns on the Live Smart program, safeguarding and the use of personal protective equipment. The Live Smart initiative, pioneered by the Dental Wellness Trust, involves hand hygiene first and foremost, followed by a toothbrushing sequence that covers all surfaces of the teeth and mouth effectively and efficiently. The interns audited this programme that has been running for the past 6 years and were able to compare the new data collected to past audits. They also carried out research projects during their time there. The Dental Wellness Trust is currently working with the University of Western Cape to study the impact of fluoride varnish application by trained toothbrush mamas.
We also introduced a fissure sealant program, and we even recruited volunteers from various other countries to come in and do some 3-day splurges, blitzes if you like, and we sealed a lot of people's teeth. And then it became apparent that it's hard to do that in a community where you don't have lots of dental equipment, dental chairs, suctions, lights.
2019 was the first year that the Dental Wellness Trust rolled out their Live Smart programs in Kenya and Indonesia.
In February 2019, I went to Nairobi, and the area that I've chosen, the pilot supervised toothbrushing program, is called Kibera, which is Africa's largest urban slum. So we saw about 250 kids between the ages of 4 to 6, and some of them, they've never seen a dentist, and they don't even own their own toothbrushes. So it felt very good to be able to see them.
This crisis not only impacts the child's oral health, but also impacts the child's physical and mental development. This has a huge impact on them later in life. Initiatives such as the supervised toothbrushing program delivered by the Dental Wellness Trust is vital in preventing childhood tooth decay and preventing unnecessary suffering here in the UK and abroad. We thank you for your continued support and donations to provide the means and education to those children most in need. Thank you.